speaker is Georgia Davenport. She's the field director of Whole Washington, and amongst other things, she'll be speaking on how state-level single payer can lead to guaranteed healthcare for all, how HR 5010, or whatever the bill number might be in our 117th Congress, would make it easier for states to implement single payer, and how Whole Washington already collected more than 100,000 signatures in the past and is now on its way to another campaign to implement single payer in Washington state. So for a more official introduction, Georgia served as the Whole Washington campaign director and led the 100% volunteer effort to pass universal health care via ballot initiative in 2018. In 2017, she founded Whole Washington, filed the paperwork with the Secretary of State, and began all the necessary steps to form a 501c4 capable of running a campaign. In late 2018 and early 2019, Georgia, along with members from the Whole Washington Initiative Writing Committee and Senator Chase, met with the Revenue and the Employment Securities Department to vet I-1600 so that it can be introduced in the legislature as a fully funded and easy implementable bill. Georgia now serves as the Whole Washington Field Director, as well as the Field Director for One Payer States, an organization that advocates for state universal healthcare bills nationally. She also ran for state legislator this year on a Medicare-for-All universal healthcare platform. Georgia, we're so excited to have you here and can't wait to hear more from you.
Thank you for that introduction. I'm really, really excited to be here. And one of the reasons why I'm so excited to be here is because the opportunity to just collaborate with other groups around the country is an amazing, amazing thing. I know that all of us have been kind of operating in our own lanes for a very long time. I feel like we need to not reinvent the wheel with all these state groups. We need to really collaborate and share information and ideas. And in that respect, I'm so very, very excited to be here. Let me figure out how to share my screen real quick. Always a challenge. And I do live in rural Eastern Washington, so apologies if my internet isn't the best. But I'm tethered to my phone, so hopefully it'll be okay. But so today I'm going to go over the history of Whole Washington. I promise I'll keep it brief. I'm not trying to bore you, but it's pretty interesting to me because, you know, I'm not a lawyer or anything, but I really, really felt passionately about universal healthcare. So I did a lot of things that are way out of my comfort zone. For example, like Tammy said, I filed a 501c4 with the IRS, with the Secretary of State. All of those things I had never done before. We created a board, a steering committee, articles of incorporations and bylaws, all those things. 5 years ago, if you had asked me what any of those things were, I would have been like, no clue. So unfortunately, I had a great lawyer friend in Michigan who walked me through that process. And I've actually sent the line by line directions I followed to Stefan. So he has those too, if he could share those with anyone who's interested in what I did step by step to become a 501c4 for Whole Washington. But moving along, so I feel like that most of what's in this slide has already been said. I'm the field director for Whole Washington. I'm also the field director for One Payer States, which is a great organization that I saw in the chat, somebody was talking about states kind of coming together and working together. One Payer States is as a group that if you're interested in seeing what other states are doing, that's a great organization to become part of. And they have monthly meetings and a great listserv. So I encourage you to go to that website, onepayerstates.org, and get involved with that organization. I'm also a state committee member for the Washington State Democratic Party. I've been for about 5 years now with a few different legislative districts. And now I'm the state committee member for Stevens County up in kind of the northeast section of Washington State. A very, very red district. So I didn't win my race for state legislature, but that wasn't really my purpose. I would really like to win, but something I'll talk about later in the slideshow is that it's really difficult for organizations like Whole Washington, and I'm sure you've experienced this with your own organization, to get in the press. They're much more interested in talking to candidates. So I thought, why the heck not run? just so I can talk about whole Washington and Medicare for all. Whether or not I win, at least, I'll get some interviews. And it was true. As soon as I ran, press organizations that have never even batted an eyelash about whole Washington were all of a sudden really wanting to talk to me about my race. So my goal was every time I got an interview to at least say universal health care or whole Washington or Medicare for all 5 times in that interview. So I would actually do that in my mind. So I highly encourage anyone who wants to put themselves out there like that. It's way out of my comfort zone. Again, I never wanted to run for office, but if you think that you could, it's a great opportunity to talk about the issues. And I see there's several representatives with us today, so I'm excited about being able to tell them about my experiences too. So that's great. So what is Whole Washington? Whole Washington is a grassroots organization that started out of Initiative 735. I was a staffer for Initiative 735, which was the initiative to overturn Citizens United here in Washington State. We were supportive of HJR 48, which is the national bill, basically creating a new constitutional amendment that corporations aren't people and money isn't speech. When that bill passed, that initiative passed in 2016 by 64%, the campaign staffers were kind of like, what next? We know a lot about initiatives. What's the most critical issue we think that we need to push for via an initiative? And all of us agreed it was healthcare. Campaign staffers historically don't get healthcare because it's just too expensive, especially for grassroots progressive campaigns. It's just too expensive to get healthcare for their staffers. So we all felt very strongly that we needed to start a universal healthcare initiative. We ran an initiative. We got about 105,000 signatures, 100% volunteer. It was our first go, which is typical. You don't get the required amount of signatures your first time running an initiative, especially if you don't have a lot of money, which we didn't. We spent about $75,000. Most initiatives spend millions of dollars to get 300,000 signatures. We only spent 75,000. So that was pretty good. But just like most grassroots initiatives, we were gearing up to try again. The initiative that I was talking about before, 735, it started out as an initiative to the people, didn't get enough signatures, had to go again, and then won. So this is pretty typical for a grassroots initiative to have to go twice. So we were gearing up to go again, collect signatures again this year, but then COVID-19 happened. All the big events got canceled. That's what initiatives rely on here in Washington State, to collect thousands of signatures in one day. You go to like Folk Life Festival or Pride parades, that sort of thing, marches. Since all of those things got canceled, we decided to really focus on our bill in the legislature, which, great news, it was dropped in the Senate today. So it's been an exciting day for me. And we're supposed to have also a House bill dropped very soon. So that's great news for us, and we're excited that you all will have a bill as well. That's awesome. So yeah, we're gonna try to do an initiative to the legislature this year as well, but that looks kind of dicey. I don't know if we're gonna be able to run one, just because gathering signatures in person is so challenging right now, and we want to make sure that everybody is safe. I have a young child who might actually come in at any moment. I'm homeschooling her. So if we do get interrupted by a 9-year-old, I apologize for that. But, and then my parents live close by and I don't want to expose them to the virus. So we're kind of like seeing what's going to happen. But at this point, we're going to file the initiative and see where we're at in April to determine whether or not we'll collect signatures. Challenges of healthcare reform. So I've already talked about forming an organization or a campaign. You know, you have to have your paperwork in order and file as a nonprofit with the IRS and all that kind of boring stuff, technical paperwork. Another big challenge that I'm definitely willing to take questions about this, because maybe you've experienced it locally, is arguments over strategy. You know, we get oh, we have to do this nationally because states don't have enough money to do it. We have to do this by the state because it's never going to pass nationally. And then different like state groups have different strategies to get to single payer. And that's been one of, I think, the most demoralizing parts of my work in the last 4 years is just the arguments between different groups of like strategy, when I really feel like that's a waste of time. We just need to like all work together. No matter what strategy we are using, we just should support each other, because we're a whole lot stronger if we're supporting each other rather than infighting. Marketing. That was a big, we probably spent about 6 months talking about what we were going to call our campaign. Are we going to call it single payer, Medicare for all, Medicaid for all, Apple Care for all, you know? And so we actually did polling. It cost $4,000. That was part of the $75,000 that we spent during our campaign to do polling to see what worked the best in our state. And it was just very obvious that universal health care was the term to go with here in Washington state. I feel that like not very many people knew what single payer was. There are a lot of people who have kind of like an adverse reaction to it just because, and I'm a huge Bernie supporter, so don't hate me for saying this, but just because there's a lot of divisiveness around the Democratic Party about Bernie versus whatever. So single payer is kind of affiliated with Bernie. So I feel like that's one thing that one reason why single payer didn't poll as well here in Washington. And also, we didn't feel like Medicare for all was really accurate for a state level bill, and it didn't actually poll very well in Washington state either. So I've already kind of talked about getting information out about your efforts. A lot of the times the press is not really interested in talking about a campaign or an organization. They're much more interested in talking about candidates. So we ran 3 people. Whole Washington ran 3 people this last election cycle. And we got a lot more press as a result. And now they're actually talking about us. We have some local newspapers that want to do articles about our bill once it gets a bill number. So that's pretty exciting. And I think that we really broke the ice with running some candidates. So one thing that Stefan wanted me to talk about, and it's kind of a little wonky, is the waiver restrictions federally. I'm just going to do one slide about it because, like I said, it is a little wonky, but I'm happy to go more in depth in the Q&A section. But so as you all might know, there are federal waivers that kind of restrict states from using Medicaid and Medicare dollars in state plans without you kind of requesting permission, essentially. So Ro Khanna has introduced this bill, HR 5010, which probably will have a new bill number, but it streamlines the waiver process so that we can get the most amount of administrative savings when we pass a universal healthcare single payer bill in our states. So that's one thing that Whole Washington's really pushing for, because our ultimate goal is to get as close to single payer as we can in Washington state. There are a lot of loopholes that you need to jump through, unfortunately, but some of them are there because the federal government was worried that states might use Medicaid and Medicare dollars in a not so great way. So there are certain rules with those waivers, like you have to cover at least whatever the Medicaid program covers. Like here in Washington state, we have Apple Care. So with Whole Washington, our program, if passed, would have to at least be as good as Apple Care, which it's actually as good as Apple Care, if not better. We cover vision, dental. Part of our bill allows us to negotiate pharmaceutical prices and that sort of thing. So it actually is better, but some states, you never know if they have a Republican legislature, they might want to use those Medicaid and Medicare dollars for something else. And so that's why those waivers are in place. But Ro Khanna has this great bill to help us states out who want to expand healthcare to everyone. in their state. Okay, so I want to talk a little bit about the campaign tools that Whole Washington uses. We use, for our database, we use Action Network. It allows us to send emails out to everyone who signed up. It allows us to do letter writing campaigns. So if we have like our bill, we want people to be able to go in, just put their address in, and with one press of a button, they can send an email out to their local state legislators about our bill. It's very easy to use. It allows you to create events, RSVPs, that sort of thing. It's a great tool and it's really inexpensive. We were using Nation Builder at first, but that was really expensive and not very reliable. This is only about $15 to $30 a month. We use WordPress for our website. We use ActBlue and Anadot for our fundraising. We also have every social media that you can. I even signed us up for TikTok, but I don't really know how to use it. So hopefully we can get some younger people to do some TikTok videos for us. And we use Slack and Trello for like our organizing tools. So like if we want to organize tasks to different members of our volunteers, we can say, can you create this graphic for us, for our graphic designers, that sort of thing. Allies, One Pair States, we've already talked about them. They're great allies. Other state groups, please reach out to other state groups. That's what Whole Washington has been doing. I've talked to at least 3 other state groups in the last couple weeks. And another great group that I always like to point out is Red Berets for Medicare-for-All. They knit these wonderful red berets, and they're great to wear to marches with your buttons on them. State-based reform. That's how Canada did it, province by province. I really believe strongly that this is the best path to getting universal health care in the entire United States, but we do also support Medicare for All with Whole Washington. We went to the Medicare for All hearings. We've organized barnstorms, car caravans for Medicare for All, but we're really committed to not only getting it passed in Washington State, but other state groups. So with other state groups. So that's why I'm here today, is I really want to create those bonds and that coalition so we can get this done state by state. So I want to talk a little bit about the benefits of the Whole Washington Health, the initiative and the bill that we have. We wanted to model it after Medicare for All, which, 100% coverage, no deductibles, no crazy deductibles, no out-of-network costs, vision and dental is covered. And you can see the entire list of the benefits on our website. We actually hired Dr. Gerald Friedman to do a funding study for us. If you're not familiar with Dr. Gerald Friedman, he did the funding study for like the national Medicare for All plans and a bunch of other state plans, just to see. We have some challenges here in Washington State. We don't have an income tax, so we had to get creative with how we were going to pay for this. We have 13 billionaires here live in Washington State, and like I said, we don't have an income tax, so they pay zero. So the biggest contribution is from those billionaires. We have an 8.5% capital gains tax in our bill. We really wanted to get healthcare for everyone, but we also wanted to de-regressivize our tax system here in Washington State. We have the most regressive tax system in the United States. One of the biggest challenges of collecting signatures or just anything, just talking to people about this, is they always want to know, how much am I going to pay for it? So we partnered with this great group called the Progressive Coders Network, and they created a savings estimator for us. So if we're out talking to people, we can just pull up our website. They can put in their numbers of how much they currently pay for healthcare, and then they get to see how much they would save if the Whole Washington Health Trust passed. So that's a great tool. I would definitely encourage you checking it out. So, with me, my family would save about $2,000 annually if the bill passed. So like I said earlier, big news today for me, it was huge relief. Our bill dropped in the Senate. Sometimes it's a waiting game and you have no control over that. So I was pretty nervous. I was biting my nails, but it did drop today. But if it doesn't pass, we're very lucky in Washington State to have the initiative process. We can collect signatures, get a ballot measure on the ballot, people vote for it, and it becomes law. The governor doesn't even have to sign it into law, it just becomes law. So we can circumvent the legislature if they refuse to take action. So like I said, we did polling to determine the best language for our bill and for our initiative. We've been doing fundraising for the last few years to get ready for running our initiative. We have a goal of 3,000 volunteers that will pledge to collect signatures. Right now, we have about 200 volunteers who have pledged to collect about 200,000 signatures. We can file in March. The deadline to collect signatures is January 2022, and then it would be on the January 2022 ballot. So I want to talk about current events. So I don't know how many people here were following the Force the Vote discussion that was happening recently, mainly on Twitter, but there was a lot of infighting. And it was a little demoralizing for the past few weeks, but I think that some great things have come out of the last 2 weeks as far as getting the pay-go requirements dropped for COVID-related bills. So Bernie and Pramila Jayapal have this great emergency healthcare legislation that they've introduced. They introduced it in 2020, and they're planning, I believe, I just saw an article by Bernie saying that he was pressuring Biden to pass this bill. So I think they're going to reintroduce it. And because they dropped pay-go restrictions for COVID-related bills, this bill could just go right. It could get done. It's actually pretty exciting. And I know that a lot of organizers, including some organizers in one-payer states, believe that if that bill got passed, that so many people would be really, really happy with that change that there would be no way that anybody would be for taking that away. And we could expand to Medicare for all because people would see how great the system works. So that's really, really exciting development. As you all know, all the countries who have gone to a Medicare for all system have never gone back. So I feel like once we get there or get very close to there, people will go, oh, this is what everybody's been talking about for so long. Yes, we want this. So I'm really excited about that bill. And I'm really excited about state groups joining together. Like I was saying, you know, if we band together and we have a unified front, we can fight the insurance companies and the pharmaceutical companies that much easier. All right, sorry that took so long. I don't usually talk this long. So I'm really, really happy to take any questions at this point. If anybody wants to ask me anything, I'll stop my share right now.
Thank you, that was great. So for questions, if people can just, I don't know if people know about the stack system, but basically if you can just type stack in the chat, and then I can kind of go through and start calling people so there's no interruptions or, you know, multiple people asking at once. So Stefan has a question.
Yes, thank you so much, Georgia. Thank you. That was an amazing presentation. So, and thank you for laying everything out, how you did it, all the tools you used, and it's amazing. I do have a question. Often we look at the work that still is ahead of us, but I would like to ask you, just looking back, is there anything that you feel, oh wow, we planned like an event or some kind of campaign or action, and that went like really well, like that you say, oh, so that's actually like, you know, a success, like you planned something, say, and it also worked out, or some kind of like especially positive experience that you made along the way?
Yeah, it wasn't me, but our campaign director, Sean Kavanaugh, has been doing these online movie showings of Fix It, And well, actually, no, it was a Canadian, the movie about how Canada got their single payer system. I can't remember it off the top of my head, but the other one that he's been showing often is Power to Heal, which is a great movie about how Medicare for All, or Medicare, sorry, not Medicare for All. I'm just so used to saying that phrase. How Medicare, the system, was created to begin with. So I feel like those online movie showings have been one of the most successful things that we've ever done.
Amazing, great.
So I think Patrick has a question.
Hi, thank you so much, and thank you so much for your presentation, Georgia. In your map, you noted that Vermont had passed a single-payer legislation, but it looks like they've since abandoned that. And I was wondering if what lessons, if any, you had learned, or your team and organization had learned from what happened in Vermont and how they failed to get things off the ground.
Yeah, so I think the governor killed it at the 11th hour. They did pass it through both their chambers, but there was just so much political pressure on the governor that he folded, even though that's what he ran on, was passing that legislation. I think the biggest lesson for me is that and this happened actually in California too with 562. They passed their bill, and then Anthony Rendon said that it was woefully incomplete because it didn't have funding. That's why I really like the initiative process, I'll be honest, because we don't have to rely on the governor's signature at the end of it. We're using the legislative process to kind of get information out about us and get momentum. But at the end of the day, I really feel like we're going to have to do this via an initiative. We have two chairs, Democratic chairs, both in the healthcare committee for the Senate and the House here in Washington State. They've been there for decades, Eileen Cody and Annette Cleveland, and they take thousands of dollars from the for-profit insurance and pharmaceutical companies. They've never let a single payer bill out of committee, and I don't think that's a coincidence. Despite however much pressure we put on them, they always have a convenient excuse to not let the bills have hearings or let them out of committee. And I feel like that's kind of what happened in Vermont, is that, the excuse was we don't have enough money, but we all know that it's going to save money. It's just about political will more than anything, in my opinion.
So I think Tony has a question.
Hello. I'm from East Hartford, Connecticut. As someone has said it in the chat, Hartford is the insurance capital of the world. Now, I'm for Medicare for all, universal health care. My mom would love that. A lot of people I know would benefit them. But thinking on the terms of the district, District 1 in Connecticut for Hartford, that would be a lot of jobs lost. Now I'm thinking, just like how the CDC's headquarters is in Atlanta, Georgia, if we do go about a universal health care, would that require headquarters too? And if so, would putting that headquarters in Hartford, would that appease the Connecticut congressmen and women, Congress people, to possibly help them accept the idea? Because I do believe that Medicare for all, universal health care is a lot more Americans want that. So it's gaining popularity, and maybe well, I guess that's the question there. You guys can, thank you.
Well, that's a great question. And I don't know about your legislation, but the whole Washington Health Trust, just like Medicare for All bill nationally, has a retraining, 2 years retraining for anyone who loses their job due to the switch. And there won't really be a headquarters for if the whole Washington Health Trust pass. It creates a state-run, publicly funded system. it will create a lot of jobs, and a lot more rewarding jobs, I feel, than the insurance industry creates. I know that it's really difficult to work as an insurance adjuster and calling people about their medical debt. So I feel like, I don't know, like I said, I don't know what your bill says about the retraining, but we do in the whole Washington Health Trust have a 2-year retraining fund.
Bud, I see that your hand is raised. Do you have a question?
Actually, I wanted to make a comment. I share an office with Dr. Frank Mallett. We're both on the opioid task force. And he says that there's over $1 trillion wasted in healthcare every year. That would pay for everything. That's just one piece of it. Another piece is Unite Here, Local 26. They claim to be the biggest hotel union in the country. Their Local 26 in Boston, their family plan is $50 a month, 0 copay, and $12 max for prescription. And the reason they can do that, the only restriction is they can't go to the 4 most expensive hospitals in Boston where you're paying for research anyway. And I'm glad that the research is being done, but I think the federal government or the United Nations would be more appropriate for the funding body for that research. And finally, as far as Hartford goes, I actually worked in insurance in Hartford or Bloomfield for Connecticut General, so that tells you how long ago that was. And there would not be any net loss. Actually, I've been having the conversation with Ron Estella. We've been talking about having a forum on healthcare here in Connecticut and have panelists on Medicare for all, single payer and public option. What I see would be a shift from of the overhead. The overhead for Medicare, the latest I've heard is about 3.5%. Insurance companies, their overhead is anywhere from 20 to 50%. So what you'd be doing is shifting that from private to public. And of course, the overhead would go down dramatically, drastic. But also in workforce development, it would also free up so much money for workforce development in other places. Right now you have medical people, nurses and doctors doing billing, which is insane. You know, we have these programs to train people to do billing, and with a single payer system, it's going to be much easier and much more cost effective. Thank you. I love you guys. You're doing a great job. Keep it up.
Great comments. I totally agree.
Thank you, Bud, for your comments. We have, I think, a question from Justin.
Oh, hi. Thank you for that great presentation and very encouraging and impressive work you guys have been doing out there. I guess we're not, now, Stefan, this organization is not a 501(c)(4), correct? Or no? So, but I guess, is that something you would recommend for Connecticut? I mean, how many people did it take to get something like that off the ground to really make it? It seems like you did a lot of it yourself or with some help from a lawyer friend and so on. But, also considering that we're not, I don't know, our focus is more on federal legislation, I think, or traditionally, right? But I mean, we support universal health care in Connecticut too. But does that difference make a difference in terms of whether, it would be a good decision for this group to consider going, because when you have all that money, it obviously gives you a lot of capacity to, pay for $4,000 polls and things like that.
Yeah, I mean, it really depends on what kind of organization you want to have. In order to run an initiative campaign, you have to be a 501(c)(4) in Washington State. I'm not sure about the rules in Connecticut. If you're lobbying politicians, elected officials in Washington State, you have to be a 501(c)(4) if you're going to be doing any lobbying or any contributing to candidates, which we don't, because we don't want to get involved with that. But But if you did, if you wanted to like run some candidates and support them financially, then you would need to think about forming a 501c4. But if you don't need to do any of those things and you don't plan on doing any of those things, then I would say it's not worth the headache.
Yeah.
But to answer your question about how many people you need, with a board, you need like the chair, a secretary, and a treasurer. That's all you need, the 3 board positions to start. But we obviously have a lot more than just that at this point. We have a board and a steering committee, and our whole Washington Volunteers Facebook group has 800 people, and we have about 8,000 people in our database.
And then I was just curious, who ran for office, or did they run for like state rep or state senate, and as Democrats or as independents, or?
I ran as a Democrat. Our chair ran as a Washington State Progressive Party. One of our board members ran as a Democrat, and then for the state legislature. And then actually, I completely forgot, but another board member, Jason Call, is running for Congress in Washington State against a very corporate Democrat who has never co-sponsored Medicare-for-All.
Cool. Yeah, I ran for Congress against our representative who doesn't support Medicare for all. As a Green.
Awesome.
And you're
It's
right.
hard.
It's a very effective way of getting press attention.
Mm-hmm. Yeah.
Georgia, thank you so much for an amazing presentation. I think we're all leaving this presentation just very excited about what's to come and what we can do in Connecticut. Now we want to introduce our next guest speaker, Kristen Whitney Daniels. She is the chapter leader for T1 International's Connecticut Insulin for All chapter, a grassroots volunteer-led group that advocates for affordable and equitable access to insulin and diabetes-related supplies. Her testimonies have been featured at the Connecticut State Capitol and the U.S. Senate floor. In 2020, she attended the Presidential State of the Union as a guest of U.S. Congresswoman Rosa DeLauro. At her full-time job, she's the assistant director of a national nonprofit that focuses on justice issues and works for their NGO at the UN in New York City. So Kristen will be talking about, amongst other things, how the CT insulin bill passed last year due to CT Insulin for All's effort, and how to phone bank legislators as a way for outreach and as a way for the bill being considered in the state legislature. Kristen, we're so excited to have you.
Thanks. I'm so excited to be here. Let me just get my presentation up real quick. That introduction pretty much said it all. But just to give you like a little bit of background about how I got started in all of this, I am a type 1 diabetic, and I have been for 15 years. I also have a bevy of other autoimmune issues that have really opened my eyes in terms of medical expenses and kind of like the egregiousness of our medical system. And I have my own experience of rationing insulin. And so I found this community from T1 International about these groups that were speaking out about this issue that I didn't understand other people were going through. So it was really helpful for me to not only put a term to what I had gone through, but to find a community that was supportive and fighting for change. So our chapter is actually part of a much larger network. T1 International is a global nonprofit that was organized in 2013, and it's basically a commitment to advocating for people with type 1 diabetes around the world, just under the understanding that everyone with type 1 diabetes, no matter where they live, should have equal and equitable access to everything they need to survive. And that is insulin, that is diabetes related supplies, including test strips, and being able to access healthcare. And so there are 37 chapters across the US, and it's an entirely grassroots effort. So this started from a very international standpoint, but when the insulin problem kind of blew up in the United States in terms of media attention, these states started building this network of chapters. And so we are not only geared to people with type 1 diabetes, but all people with type 1. There are at least 7 different types out there that people don't understand are part of that network. And so anybody who needs insulin and our allies are all invited in on this. And so what I initially appreciated about this and what drew me to Insulin for All is the fact that we are entirely grassroots and a volunteer-led chapter. So we have some staff at the national level, but for the chapters, we spend really no money on legislation, and at the national level, we refuse to take any funds from insulin manufacturers, insurance companies, or anyone who could potentially influence our voice, which is something very different for patient advocacy organizations. I just wanted to give, this chart kind of says it all in terms of like why we are advocating for this. So we are centering about a very specific issue. Our legislative efforts have kind of expanded since then, but so since around 1996, the price of insulin was about $21. When I was diagnosed in 2005, it was a little bit more substantial, but by the time 2016 rolled around, the average cost, we did a study with Senator Blumenthal in Connecticut, ranged from $290 to over $400 per single vial of insulin. And for reference, I require 4 vials of insulin a month. And so this is a 1,200% change in the price and far exceeds even some of like the most expensive products that have experienced inflation. And this has obviously contributed to just a huge issue in terms of people being able to access their medications. We know this isn't diabetic specific. This is medication specific for all around. And Yale University did a study a few years ago now that found that 1 in 4 diabetics are rationing their insulin. And we expect that with the pandemic, that has gotten even worse. Some studies have gone up to 50%. And I think you could probably find some similarities in terms of messaging between Medicare for All and our Insulin for All sort of messaging and issues that we find. So one of the things that we keep getting told are solutions that are out there that really aren't patient-centric. These are really solutions that are touted by manufacturers and touted by people who just really don't understand the system. So one of them is patient assistance programs. They only help a small amount of people. They require a lot of paperwork, a lot of hoops to jump through, and there's no transparency whatsoever. And they can end at any time. When I was rationing insulin, I was literally on my last drops. I had no more insulin left, and I called the patient assistance program, and they essentially said, "We can't help you." And I was like, "I'm going to die in 24 hours if I do not get my insulin." And they're like, "Sorry, go to a hospital?" I'm like, "I already don't have money to buy my insulin, like go in a hospital." So that's kind of the response that a lot of people get. We also hear a lot about Walmart insulins, which is a fascinating look. It's older insulin. I've been on it. It's volatile. It requires a very specific regimen and a very specific care. So if you're already rationing insulin, you likely can't pay to afford to see your doctor, who you would need to keep a very close eye on you. It's also creating a 2-tiered system where rich people are able to access insulin, or people with sufficient healthcare plans, and then the poor get this dangerous insulin that we frequently call dead in bed because it's contributed to so many people with diabetes deaths. So our chapter specifically, we started in January 2019, and we held our first in-person meeting in March 2019. And one of the things that I really love about our group is we've built this up to be a community. It is not only that we are advocating for insulin and for better healthcare for folks, but we also want to make sure this is a community we can lean on, which has been so important during the pandemic. We started having weekly meetings when the pandemic first hit. As you probably know, people with diabetes are some of the most at-risk population for COVID complications. So, I mean, not that the fear isn't there now, but I think you can remember when it first hit, there's just so much misinformation and fear, and we really leaned on each other during that time and continue to lean on each other. We've continued to host monthly meetings since that first in-person meeting. And that's been from everything to develop advocacy skills, how to talk with legislators, actually having legislators visit, and build community. This is actually a picture from us doing something called the Gold Vial Project, in which we painted vials of insulin gold to say that insulin is worth gold to us, but it shouldn't cost as much. And so we've been giving it to legislators to kind of remember us when they go for votes. We've had Q&As with Representative Joe Courtney, State Senator Matt Lesser, State Representative Sean Scanlon. And even though our purpose has always been to create change in the state of Connecticut, we knew that it would always be an uphill battle. So the lead up to legislation, I think, is just as important as the legislative process itself, because sometimes when the bill gets passed, I found a lot of it is out of your control and is important to remember. And so one of the really important things is we just spoke to everybody we could talk to. I mean, I seriously mean everyone. We had this number 20 is probably very low right now, but we spoke to a lot of state and federal legislators to promote insulin for all. We outreached with many different organizations within Connecticut to tell our story, but also to see how we could support each other. Prior to the legislation, we had 34 media stories featuring our members and or our chapter. We spoke at 3 national press conferences. You can see 3 of our members right here with Senator Blumenthal. This was in July 2019. And then this is actually how I met Holly way back, was we participated in roundtables and town halls. So I met Holly at an event with Senator Chris Murphy. And that has been integral, is really building relationships with legislators who are passionate about the issue you're talking about, and also building relationships with media. We've gotten to the point now where we can go to certain outlets and say, hey, we have a story. Is there a way that you can pitch this or get this in? Telling our story telling our story, and knowing how to tell your story is just so important. One of the other things we noticed in the lead up to legislation is that there are 3 manufacturers who produce 90% of the insulin in the entire world. So one of the issues into why we have such a problem with insulin. So Eli Lilly, Sanofi, and Novo Nordisk significantly increased their lobbying leading up to this legislation, knowing that we were already talking to legislators. So way before we even had a bill, they were already starting to wine and dine legislators, bringing them in to have conversations and lunches about their patient assistance programs and all the other ways that they help people with diabetes. I wanted to point out this sheet. This is actually not mine. This is from the cga.ct.gov website. I can drop the link later, but it's how a bill becomes a law in Connecticut. It kind of steps you through the processes. I don't have enough time to go through all of it because it can often be, it has nice arrows, but it often kind of loops around. So I will just be focusing on how our legislation went from beginning to end, essentially. So SB1/HB5175 is an act concerning diabetes and high deductible health plans. And that was introduced at the 2020 legislative session. And it became, by being SB1, it was touted as the Democrats' #1 priority. And a lot of that is really owed to our members who continued to reach out to their legislators to draw attention, and also a perfect storm of media. We really capitalized on the fact that this was such an issue in the media, and honestly, it's sort of the poster child for everything going wrong within the medical community. And it was introduced in January, and I'm going to talk about some of the issues because I think that's important. Some of the messaging got beyond us. So when a bill is submitted, we didn't know what the language would look like. One of the things we were really intent on is we wanted to help people who were underinsured or uninsured. And the way that the bill originally got written, they put placeholder language in often. And a certain subset of our legislature took that messaging and said that we were going to tax diabetics, which is ridiculous because that is just political murder right there, especially with this media attention. And so we worked so hard to combat those talking points because people in the diabetic community were like, great, another tax on people with diabetes. Is it just people with diabetes? And it was wild because, you know, the only thing we're trying to do is help people. It was more formally announced at the end of January, in which case the Democrats had to kind of rework their messaging, and that meant that this help for uninsured ended up being impeded quite a bit. We had very little notice on hearings, but we were able to kind of get a 2 weeks notice so that we could mobilize our members. And we submitted over 70 written testimonies, and 20 plus people testified in a public hearing. These were all our members. We had additional people, legislators, who all spoke out in support of this bill. I point out these points because this is what the bill originally looked like. I will get to the final passed version of the bill, but as you can see, it's $50 a month, and then there's an Explorer assistance for uninsured. Both of those got changed in the final iteration. So as you know, we had a pandemic hit, which kind of derailed everything. Rightfully so. And so all the bills that, despite us moving out of the Insurance and Real Estate Committee, which is where our bill was sort of housed and sponsored by Representative Scanlon and Senator Lesser, despite it making out and going to the House for a vote, and we never were able to get that far. And so during this time, we were really talking about how do we talk about the issues affecting our community and continue to say that we need help, especially during a pandemic, to access our insulin. So we created this idea around phone banking. And one of the important things was we created a goal and we created an ask. You kind of need a call to action to think of what that is. So we also got wind that there was going to be a special session possibly happening in the summer and possibly happening in September. And we were specifically told that we might have a chance that our bill would go in September, but definitely not July. It would just, they were going to focus on the coronavirus, which we all know how that happened. But that was essentially what we were told. So we created a team of people. It wasn't just our leadership team. It was a group of members who were really committed to getting the story out there. And we kind of divvied up responsibilities, like a fact sheet. We had a phone script. We made a social media campaign, and then we had people sign up using, just a Google form. And through the month of May, we introduced this to our members, asked people to sign up. And then we kind of had like a rally beforehand, and this is all virtual, of course, to encourage people. People could ask questions. We did like a little bit of role playing about how you could how a phone call could potentially go. And from there on, we did about a week, 2 weeks of phone banking, and then we did a debrief after. And through the support of almost 30 members, we were able to cover nearly 75% of the state. I will say that not everybody was amenable to the idea, and some people had some serious issues, but everybody was really willing to listen. And despite us having this like SB1 designation, and despite having a lot of media attention, so many legislators did not know anything about this bill and anything about the issue. So I think it's important to always remember that there are a lot of people, as much as you think people know about it, a lot of people don't. So despite being told that we were not going to be put in the July session, we were. And that was largely, I believe, because of the phone bank, because these legislators started calling their, like the heads of their caucuses and saying, we need this bill, and started talking about it. Getting legislators talking about it was so important. As you can see, the caps were actually lowered, and a 340B study / Medicaid waiver was added instead of help for uninsured and underinsured. This happened very quickly. We had to mobilize very quickly. We did a second round of hearings virtually, which was awkward, but we did it. And then we got final notice before the House vote on what the bill would actually look like. And just to say, that's not always what you ask for, and it's not always what you look for. There's a lot of behind the scenes negotiations. So at the end of July, it went to a House vote. It's kind of unprecedented for a bill to pass on its first go around. Usually the bills take a couple cycles to pass. There was a lot of debate, but despite all of that, the House voted 142 yes, 4 no, and there were 5 people absent. It moved to the Senate. There was one particularly interesting person who stood up and held court for a very long time, calling us communist and socialist and all this other stuff. It was long, it was ranty, but in the end, it passed 35-1. One of the things that changed at the very last minute was that this bill did not go, only one provision went into effect January 2021, and that was a provision, and this helps people, so feel free to share this knowledge, is that anybody who has a diabetic and has insulin or other diabetes related supplies, if their prescription runs out or if they can't get in contact with their doctor, they can get an emergency supply once a year. And then unfortunately, the copay caps won't go in effect till January 2022, which is really unfortunate. The governor signed the bill in August 2020. And yeah, that was essentially how we moved through it. There's some more issues with 340B that I could talk about for a long time. But just to say, it's very important to keep a close eye on the bill. Every time it gets proposed, go through that with a fine-tooth comb. Every single legislator counts, but it's really important to know what committee you would be going through and then who the heads of those committees are. Become really familiar with the CGA, the Connecticut General Assembly website. We are constantly checking that. They update that much more quickly than sometimes constituents, and just share your stories. This is our contact information, but I am super happy to take any questions, and I can also drop this info in the chat. That might be a little bit easier so you can see my face while I'm taking questions. But thank you so much. I really appreciate being able to talk about all this.
Thank you so much, Kristen. I know so many of us are actually very inspired by how quickly and like nicely things moved along with this this bill. And so if anyone has any questions, we can follow the same kind of protocol of typing in stack in the chat, and I can call on you.
I saw something about the Freedom Caucus voting against it. Yes, that would happen to be the very select few that had some issues. But we did have some really good follow-up conversations with a few of them. I won't say all of them, but it's been interesting.
I think Stefan has a question.
Yes. So thank you so much, Kristen, for your presentation. This is amazing. A grassroots group being able to have this incredible success for everybody who might be cynic and say like, what is all this advocacy for? I think you just proved the reason. And I just was curious, like you said, you could talk about it for a long time, but would you be able to share like the current events about the manufacturers and the 340B program? I think that's it.
Yeah, I would be happy to share about that. So 340B is a program that essentially helps community health clinics and hospitals serve the most underserved populations. And part of that, a small part of it, is prescription drugs, where they're able to access prescription drugs for a very reduced price. It's actually the program that saved my life, so I'm a little bit passionate about it, and it's a little bit personal. My $2,000 insulin came in for $14 a month, and so it is literally a lifesaver. It's very big for HIV and AIDS patients as well. Really, what I love about it is that the more you charge for inflation, the more of a discount you have to offer. Which what a system! What an idea! And so, one of the really horrible things that happened during this pandemic, and it actually started happening right after this 3040B provision got introduced in Connecticut. I don't know if there's any relationship. I think it might have more to do with the presidential executive order, but I couldn't tell you for sure. 6 manufacturers have decided to pull out of the program in some way, shape, or form, meaning they will no longer offer discounts through the 340B program. And for people on insulin, that is all 3 manufacturers. So in some places, in some pharmacies, there will be no low-cost insulin option. And so that's something we're keeping a very close eye and we're advocating for within the state.
Great. I think Adam has a question. Never mind. Oh yeah, Holly said stack and then she took it back, but she wants to say thank you for all your effort.
Yes, I was actually going to ask Kristen to talk about 340B because it is so important that everyone know what's going on. So that was going to be my question, but Stefan stole it. But on a personal note, I would like to say that Connecticut Insulin for All is an amazing community. Kristen's an amazing advocate. Everyone in the group has taught me so much, and I don't want to go on because I can forever about how wonderful the group is. And they're just terrific people and great advocates. And I'm glad she's here because we can learn a lot from her and everyone in the group.
Thank you, Holly. I've appreciated everyone's support too, especially from the Medicare-for-All community. And during the phone banking, y'all were so helpful. And it really has been a group effort. And I am continually inspired by our members because we don't have money. We put no money into this. It's really just us sharing our stories and advocating and hoping that people will understand kind of the gravity of this, and whatever we could do as Connecticut Insulin for All, we really hope to take these gains and apply it to all medical communities because it's not just us. A lot of us have co-occurring disorders. And so there's a lot of people that really need relief right now.
I think Justin has a question.
Oh, yeah, great. Amazing work. I was curious about the phone bank, about, what kind of response you got from legislators or what kind of conversations worked. And I mean, you're calling legislators, outside your own district in a lot of cases, right? And are they mostly receptive to that? Or I guess that's.
Yeah, so ideally you would call your own senator. If we had 150 people sign up, it would be great because then we could get everybody to call their own. But we asked people how many they were comfortable talking with. If they were only talking with their elected officials, we were perfectly fine with that, and that's how we assigned it. If you were open to talking to more, we prioritized people within the Insurance and Real Estate Committee and the Public Health Committee because those were two main committees that we knew we could support. We also looked at, we really didn't differentiate between caucuses, between Democrats and Republicans. We knew that in order to pass anything, this is really, it's a bipartisan issue and should be a bipartisan issue. So we prioritize people in some instances who were in leadership because we know that in a lot of cases where leadership goes, a lot of people follow. For them, we had different messaging. And I won't say it was by party, but it was by interest. So as everyone has mentioned, we're in the insurance capital of the world. That plays a huge part in things. And so we had messaging about this will save you money because people with diabetes end up costing you a lot of money if we have kidney problems, which is what happens when we ration insulin. But we also, had people who were able to share their stories. Not everybody has like hardcore rationing stories. So other people were able to share other people's stories or say, like this is a public health issue. So, really providing different messaging for how they think people would be receptive and giving people enough time to do the research on the legislator they were talking to. So some people found some strange commonalities that they were able to be like, oh, hey, I know you like farm stuff too. And like be able to, I work on a farm, like everybody's human here and find those commonalities.
And in most cases, they could talk to the legislator themselves.
Yeah, some of them talked to just their aides, which I know we have some representatives on this call. So they, every time somebody calls or emails, it's sort of registered, especially on what issue. And we know often that if at least 5 people call on the same issue, that's often like a trigger that they have to start paying attention to it, or you might get a call back on that, especially if you're a constituent, we tell you, please say that you're a constituent. It took me 1.5 years to get my elected senator to talk to me, but it happened right before the vote, so it takes time.
Great work.
Thank you.
Adam, I see you have your hand raised, your question, and then we have to then move on to the next part.
Thank you. My name's Adam. I live in New Haven, where I serve on the local city council, the Board of Aldermen. And I work on health policy for Unite here at Yale. I think one of the things that's really crucial about the work that Kristen is discussing is, first and foremost, it affects real people with real medical conditions who are being put in harm's way because of the predatory practices of these for-profit companies that manufacture these life-saving medications. But I think when we talk about health reform, one thing we must do is focus on regulatory authority, the ability to regulate price. When we talk in the general culture about healthcare cost, we talk about cost a lot, but we don't talk enough about is price. And that is the unit cost for medical services, devices, and pharmaceuticals. And in our country, we have not developed the will just yet to regulate those prices. It happens in a few places, like in Maryland, there's a board that oversees hospital prices, but it's an authority that the government has, but which politicians over many years have not been able to get together enough to exercise. And that's because of the massive influence of the lobbying industry, the hospital lobbyists and the pharmaceutical lobbyists. Recently, in 2017, my union led an effort in both Nevada and in California to introduce price transparency legislation. In Nevada, it was in regards to diabetes medications, and in California, it was broader. And we passed both bills in a coalition with medical associations, consumer advocates, patients, other unions, but it was a Herculean effort. And it took a heck of a lot of organizing and a lot of work. And the people on the ground who were doing the work, lobbying the legislators, they were outnumbered 10 to 1 or 100 to 1 by industry lobbyists. The pharmaceutical industry and the hospital industry, the healthcare industry is immensely invested in lobbying. And so it's, you can't underestimate, I think, the difficulty of passing meaningful legislation, but it can be done. One more thing I'll say before I stop is those of us who've been in Connecticut for a while will remember Sustanet, the drive to create a public option. And the kind of apex of Sustanet was legislation to create a study, and the study was supposed to lead to more legislation. And candidate Daniel Malloy, running for governor, supported Sustanet. Now, when he got elected, what did he do? He changed his mind and effectively killed it. Now, I've heard from folks who represent, who are in Hartford, who are part of the state delegation, that we may yet see more legislation, including in this session, about a public option in Connecticut. I don't think it's a Medicare for all option, but who knows? But there was an attempt last year, didn't get very far, to create a public option in the exchange, which would create competition for those private commercial options that are in Access Health Connecticut. So that's not going as far as a single payer, that's for sure. But it's a step in a positive direction. So I think there's going to be a number of bills in Hartford that touch on health reform. I know, well, I won't go through all the names of people who've been active on it, but there have been a number of people in the legislature active on it. And I think folks in this call really ought to pay close attention to that. And I encourage everyone to engage with your local legislators about what bills are in the works and what bills should be in the works. But don't forget price, because who pays matters. The reason why the federal government gets a better price, because it's got an IRS and a military and a court, and it can tell hospitals and doctors' offices, here's what Medicare is going to pay. That doesn't happen outside of the government context. So we can't cover everybody. We can't provide a system that provides care for everybody unless we deal with the price and we deal with the power of the private industry, the for-profit concerns that have jacked up our system. Sorry for that tirade.
I was just going to add really quickly that our idea is that we really want to address manufacturer pricing. PBMs and insurance companies, all of them have their issues, but list price is what really matters since so many people pay it. This bill does not address list price that was passed, as you can see, but we do know that it will help people. I think a lot of people thought that like once we pass this one bill, we would be done. And I think some legislators will be surprised to see us that we are advocating for more stuff at this next session. So, you know, moving the needle sometimes slower than we hoped, but I think every time we're able to keep bringing our efforts and keep sharing our stories, we'll keep inching it a little bit further.
Thank you, Kristen, for your presentation. Adam, thank you for your comments, because that was a perfect transition to what we want to talk about next, which is a new single payer bill for Connecticut. So we know that there's an exciting effort happening to introduce a single payer bill, which, if passed, would guarantee healthcare for all Connecticut residents. So State Representative David Mitchell, if you're here on the call, which I think you are, we'd love to hear any updates that you have about the single payer bill or anything else you'd like to talk about.
Thank you, Tanya. For just time constraint, I think I'll let our champion talk about some great updates from today. Rep. Ann Hughes.
Well, thank you, Rep. Michelle, and I also see Rep. Winkler is on the call too. We are all co-introducers of the single payer. It's LCO number 752, Connecticut's Family and Business Health Security Act, a single payer healthcare proposal for all Connecticut residents. And we attached to the latest version that LCO 752. We attached the latest version of the proposed legislation, Stefan, that you had given us this morning to pass along to LCO. And the plan is to, to the proposal. And the plan is to introduce this in Human Services and get a hearing on it and really galvanize public momentum around Connecticut taking a hard look at what the costs and the savings would be of a Medicare for all option in Connecticut. And just like with insulin for all, it depends on the public will behind it as to what moves and what doesn't, and how much bipartisan support we get. So we have 5 co-introducers along with Senator Moore, Representative Robin Porter, and I also spoke to newly elected Senator Jorge Cabrera about co-introducing it. He'll probably co-sponsor it because it's already been submitted. But yeah, so I'm on Human Services, so I'm going to, champion getting a very robust public hearing and raising this bill. There is also the public option bill being raised again. It has some different challenges in insurance this time around, but we're having actually an organizational coalition meeting on that tomorrow afternoon. Some of you may be on that call. So the more the merrier. I think what COVID has changed is the urgency and the demand for healthcare coverage and access. I mean, I was getting my second COVID vaccine today because I'm a healthcare worker at a long-term care facility, and one of the co-workers doesn't have any insurance. She must be part-time or per diem. She doesn't have it through the employer. And so, if people get COVID or whatever, they don't have insurance. They don't have insurance, and people are dying as a result. So we got to increase this demand that this is, if not now, when? And so.
And I just wanted to add, we're saying that we will be happy with the public hearing, but we'd be much happier if this would go through, actually.
Yeah, I say nothing is, nothing is certain. Look how the police accountability went through in a special session.
Like
Why? Because the public took to the streets and demanded that their legislators do something.
I think we also have to thank Stefan and the rest of the Medicare-for-All Connecticut, because basically in the last couple of weeks, there has been many meetings with different organizations to create this coalition and this support around Medicare for all single payer, at least for the public hearing, which means that we'll have support for the bill to be pushed through. That means that unions like SEIU, AFL-CIO, we're talking soon with the Working Families Party, who seem also very supportive, of course. And then we're also talking with Kevin Nimbo next week. So, there's been a lot of meetings that are creating some of this momentum. It's the one thing with the public option is a lot of people had been engaged on this for a long time, for months. And so I think some people might be a little bit nervous. Hey, this is going to be competitive, and we've had a very friendly approach. I'm thinking not to our demise, but just to say that in any case, nobody working on public option should be worried, because if single payer passes, then it passes, and if single payer doesn't pass, there'll be support for the public option in any case. So that's it. I think it's very exciting that we have our LCO number, and soon we'll have a bill number. We're just hoping that this goes through Human Services. So, and Senator Moore is one of the co-introducers, is the Senate chair of the committee. So we're really hoping that this will help it go through Human Services. Thank you, Anne.
Thank you. Thank you all for pushing and demanding. And yeah, everything looks hopeful in a crisis, in a pandemic. What we have to do is get the public to recognize healthcare access as a universal right, and how we pay for it. We can have the conversations and have a research and study around it, but we're all paying for it, and we're really paying for it because we're not investing in preventative and early intervention care. Yeah, millionaire tax. We're proposing that too, Justin.
Thank you so much for your work. We'll be here every step of the way trying to push it forward as much as we can. And we're really just excited to see the progress and the momentum around the issue. I know that there's one question in the chat. Patrick, I think you have a question.
Yeah, representatives, thank you so much for the presentation you gave tonight. Really appreciate it, and really appreciate the momentum that's happening on this bill. I guess I just wanted to ask, what advice would you give for folks in a constituency whose representatives, and in my case, senator, will probably not be supporting this bill? I live in Naugatuck. My representative is Rosa Rabimbis. I can already tell you that she will not be supporting it. I live in the part of Naugatuck where I am not represented by George Cabrera. My senator is Joan Hartley, and lately she's been caucusing with the Republicans most of the time. So that having been said, back to my original question, what advice would you give for folks of us who are not represented by people who will be supporting this?
If I may, so I would still keep it on the record and send an email to your elected officials, and we're just sending the same email that you would send to somebody who's supportive, that you're hoping for their support, and maybe if you could have maybe a conversation with them about it. After that, as soon as Anne or any of the co-introducers finds out the bill number and which committee it's going, hopefully Human Services again, then almost immediately we need to rally the troops to send emails to the chairs in support of this bill, to go to public hearing, at least to public hearing. It's kind of maybe I'm wrong, and maybe Anne can correct me later on this, but I'm just thinking that the best approach for the chairs is not to be too, it's an odd approach sometimes, but it's good not to push. Although Senator Moore will be a co-introducer, but for the other chair, you want to say, we would really hope you'd support this bill to go to public hearing, at least public hearing. And then maybe a couple days later, then after communicating with the chairs and co-chair and vice chairs, then you send an email to the entire committee, to all the reps in that committee a couple days later. But always, it's kind of good to start with the chairs and vice chairs. So it's like 2 email shootings. And then further, as we get closer to the public hearing, you want to prepare for another email shooting. And Mike, you might want to correct me also in case I'm saying anything that's typical for a newbie, say that is wrong. But I would also think that then you want to target the entire legislature. And there's a way to email the entire legislature. And just know that if everybody emails exactly the same email, people won't read it. They'll read 1, 2, then that's it. So it's very good to diversify the beginning of your emails. It catches more attention in the thread of emails, because if they all start with the same, personalize the subject and personalize the beginning of the letter. It's very important. And then you can have the same message later, but at least they know. So first your own reps and senators. Once we know the bill numbers, target chairs separately from your own reps and senators. And then after that, the second email shooting to the entire committee of cognizance. Mike, please take over.
Just one thing I would like to say is, you're new and you are sincere and work hard and all that. A lot of legislators don't read their emails. they have a staff person read it and give them an overall picture of what was said. So my suggestion, House districts are small. It's not difficult. The addresses of the House members are printed. A lot of them, their home phone numbers are printed. If not, it's not that hard to find them. And they'll be home a lot this session because they'll be Zooming rather than visiting the Capitol very often. So I would strongly urge people to make telephone calls to their representatives and call, as many people as you can, get to call them at home. And every one of them should ask for a face-to-face meeting on the issue on Zoom or whatever else. If somebody asks why face-to-face, you can say you have slides you want to show them on shared screen or whatever. What I'm trying to say is that the more time you threaten to take up for a legislator, the more likely they are, if they don't care about the issue, to say, oh, all right. So you should try to have as much personal contact with them outside of emails that you can.
And I would just like to add that the success of Insulin for All, or the SB1, build on that. I think Joan Hartley voted for that, right? Am I correct? And I think ultimately Rosa Rabimbus did too. So
I believe
building
they
on,
did.
yeah,
Yeah.
so I would just build on that and say this was an incredibly encouraging bipartisan effort to get access to insulin for all diabetics. We kind of need that same kind of access for everybody in a health pandemic, don't we?
Yeah.
And to build on that, and we can differ on ways to approach it, like I said, but the public momentum behind a public hearing is mostly to hear your stories about it, just like with the Insulin for All community, how critical it is that we have legislation to provide access because it saves lives. And we know that in a pandemic, we know that, with a life-threatening chronic disease like diabetes, and there's so many people uninsured in this, and with lack of equity in healthcare, it is catastrophic, and it is a policy choice that we are making. It's a policy choice. It's not inevitable. And how can we justify this policy violence?
Yeah. Thank you so much. Yeah, Representative Rabimbus is difficult to get in touch with. She often doesn't return phone calls, and yeah. But thank you very, very much. I appreciate it.
Thank you so much, Representative Winkler, Representative Mitchell, and Representative Hughes for this exciting progress and work, and all of this advice. Myself, I'm new to kind of advocacy, so hearing all this is actually very, very helpful. We really appreciate it. So we wanted to move on to just do a quick discussion about the Willimantic resolution effort. So in Willimantic, all the way in northeastern Connecticut, in the so-called Quiet Corner, members of Quiet Corner DSA are working on an effort to have the Willimantic Town Council pass a Medicare-for-All resolution. Donna and James, are you with us? Would you be willing to provide us an update about the status of the resolution effort?
Hi, yeah, I'm Donna. I can do that. So it's going to come before the town council on this is Tuesday, so next Tuesday, the 19th. And I've had communication with our mayor. He's supportive. And he has in turn had communication with our state representative, Susan Johnson, and she's also supportive. So he said that he expects it to pass with little discussion. And I'm still kind of trying to round up some people to, locally to call in the public comment period to speak. Yeah, we've been trying to get in touch with just local medical professionals and faith leaders and stuff like that. Been a little challenging to nail people down. Professor Mark Stelzner from Conn College, he said that he would call in and give a short presentation. So we've got him, and yeah, I've just been reaching out to, trying to reach out to folks, trying to track people down and everything. So yeah, but so far, the mayor said that he expects it to pass with little discussion, but figured it would just be good to have a few people at least calling in to support. So that's where that is.
Great. Thank you, Donna, for the update. Now we wanted to kind of talk about, how we can all take action on the new developments, both in the state and more broadly. So on this Friday, we're planning on having a meeting to plan a potential phone bank for the CT single payer bill. I think Stefan can talk about this a little bit more.
Sivan, do you want to speak a little bit about the planned phone bank?
Sure. Hi, everyone. So yeah, this Friday we will come together to talk about sort of the plan for contacting our state representatives, go over basically the script, what we're asking of them in this sort of first round of phone banking, which is really just to get on the record, suss people out who definitely supports and we don't need to pursue them anymore, who's sort of still on the fence and we need to do more work, and who will definitely not do it and we don't need to bother with them anymore either. But bring them to public attention anyway. So yeah, we'll do probably do a little bit of training, maybe do that as well, and then that would lead up to I think a week or 2 weeks of making calls, and just showing how we'll track the progress as well.
Great. Stefan, do you have anything else to add?
Sure. So I think it was so inspiring to hear from Connecticut Insulin for All. It's amazing, like what they did, all of their activism, and that they were able to actually pass a bill. And for that part that Kristen spoke about the phone bank. So it's not only phone banking, one can also, for example, send emails or like reach out in other ways. But yeah, right now in the pandemic, of course, also the phone is a good way to reach out. So yes, in case you're available on Friday, 7 p.m. So I just dropped the Facebook event link or the Zoom link in the chat to just make your voice heard, reach out to your own state legislators or other state legislators. So we're going to talk about all of it more on Friday at 7 p.m.
Great. And there are also other actions you can take. So on a very local level, we can ask mayors and town councils to pass resolutions, for example, like the one in Willimantic that was Donna discussed. I know that there's potentially a New Haven resolution that might be kind of rediscussed. And so if that's something you're interested in, be on the lookout for an email about that. And then of course, on a national level, we can call federal legislators to co-sponsor Medicare for All. And like was discussed earlier, also supporting the new bill about basically providing healthcare or allowing people to sign on to Medicare for those who lost health insurance during the pandemic. So there are also a lot of national actions that can be taken as well. So there are also a lot of upcoming meetings and projects. I think Stefan can always talk about this. I feel like I'll miss something, but Stefan will introduce more exciting meetings and plans that we have in the coming months.
Yes, so just switching over to the announcements sections. So on Thursday, which is the 14th at 8 p.m., Public Citizen is going to have their Medicare for All resolutions webinar. So this is about Medicare for All resolutions, like the one that Donna just spoke about in Willimantic. At the same time, there's also going to be Ro Connor, U.S. Representative Ro Connor, as a special guest who will speak about not only the federal Medicare for All, as far as I know, but also his legislation that Georgia mentioned at the beginning of the meeting in her presentation to make it easier for states to pass a single payer bill. So that is going to be on Thursday, 8 p.m. Then, of course, on Friday, 7 p.m., we have the Connecticut Single Payer Phone Bank meeting. Next week's Tuesday, there is a another meeting with National Nurses United, Medicare for All in the 3rd Congressional District. So Sivan, for example, did you hear anything from James about that meeting? More information?
I actually emailed him about it today. We have, as you know, with the insurrection, there's been a bit of delay on hearing back from people in DC. But really, what we'll do at this meeting is just update what's happened since the last meeting and continue that discussion.
Okay, great. Thank you so much, Sivan. So that's going to be on Tuesday, next week's Tuesday, which is January 19th. And the time is going to be, I think, 7 p.m. if I remember correctly. Might be 6:30. So that information is also going to be included in the follow-up email to this meeting. In addition, we do have on the next weekend after that, January 23rd, January 24th, Healthcare Now, the National Single Payer Strategy Conference. This year, it's going to be all virtual, of course. So it's still possible to RSVP now, registration fee $50, or to request a scholarship in case one does not have the funds. So that's going to be Saturday and Sunday, January 23rd, 24th. On Tuesday, January 26th at 5 p.m. Eastern Time, Whole Washington has a book club with special guest Wendell Porter. So Wendell Porter, being an insurance industry whistleblower, actually lived in Connecticut and worked as an executive with a health insurance company for several years. And then, was now able to reveal the practices of the insurance industry in his bestseller book, Deadly Spin. So that's going to be a virtual event on the Tuesday, January 26th. And finally, we have on Thursday, January 28th, the next Connecticut Insulin for All meeting. So Kristen mentioned earlier the 340B program and the cuts that manufacturers are making to it. So there's going to be a presentation by Dr. Laura Nally with an overview of the federal 340B program. What does it mean? The current situation of manufacturers withdrawing prescriptions from 340B, and the threat that there is on members of the diabetes and other chronic disease communities. And of course, also ways to get involved. So that's going to be on Thursday, January 28th, 6 p.m. Yeah, and I think that's kind of the upcoming announcements that I have. Anybody has anything to add, anything in addition?
I just noticed that Holly had written stack in the chat. Holly, do you have any questions or comments?
I actually just wanted to say, I hope that everyone who's signing up with us for the phone banking realizes that you see Representative Michelle, Representative Winkler, Representative Hughes. If I'm missing anyone, my apologies, no disrespect. They're regular people. They don't mind getting calls and speaking to their constituents. Just talk to them like they're normal, everyday people. There's nothing to be nervous about. Actually, I enjoy it. And it gives you a look into our process. And we should know more about it if we don't already. Please excuse me. But I actually am looking forward to it. So please do join us. I think it's going to be terrific. I think we're going to learn a lot because you're not just going to call them. We're going to ask that everyone let us know what their responses are. And I'm actually curious to see. So please. Normal people, everybody. Just like you and I.
I would say that as we are getting ready to message this, we are calling it, whatever we called it, the healthcare, the Connecticut Family Business Health Security Act, because this is where security really is, and we're referring to it as a single payer health care proposal. Just for Connecticut. That seems to be something that inspires more curiosity than disgust or dismissal.
Well, thank you so much for everyone's attendance. It was great to see so many new faces and old faces. And we have a lot of really exciting and interesting things planned for the coming couple of weeks. And so we're very excited that you all are joining us. Most of my Zoom calls don't end early, but I think this will be one of the first ones. So we will hope that you have a great rest of your evening, and we hope to see you sometime again in the coming week.
Thank you. Take care. Bonsoir.
Thank you so much, everyone.
Bonsoir.
Thank you.
Do you folks know who is kind of championing the effort to pass a resolution in the board here in New Haven? Or is it not that far along yet?
I was going to
think there's
ask that
even a
same
resolution
question.
text.
Okay.
I think at some point of time a text was being created, a resolution draft.
But is there like a point person for your organization in New Haven who's going to do that? Or is it one of my colleagues that you've been in contact with?
That's a good question. It seems like we have had people in New Haven, but I can't remember offhand. Of course, the SNAP group at Yale has some involvement, but I think there were some, a couple regular local people. So I'm not sure.
Perhaps it was with Pete Cunningham. Maybe he did it in conjunction with doing the Hampton resolution, because there were people who knew Justin Farmer, and Justin was in touch with perhaps an alder from New Haven. I'm not certain, because I would love to know as well, because Alicia and everybody else who's doing work on different boards there as well. So I was going to ask the same question.
I think in addition to Pete, also Sivan mentioned something about it today, about the New Haven resolution.
Let's text Sivan and ask her.
Well, whoever it is, please put them in touch with me. I'm, probably more involved in health policy than any other colleague in the board. So, although there's a number of people who are interested in it for sure. And so I'll send you my contact info, which is in the chat.
Great, thank you so much.
Great, thank you.
Thank you so much.
Good to see you. Bye, everybody.
Thank you. Take care.
Have a good one. All right, so.
Oh,
I think I'm gonna send out a follow-up
you
email.
joined us. Dana,
Oh,
I haven't seen you since class. One of my classmates. Sorry, guys. So I'm sorry, I didn't mean to interrupt all that.
No, that's all good. So I guess unless there's any more questions, okay, then we can formally end the meeting.
We can. I've been reluctant to formally end because a couple people have closing remarks. But yeah, and I guess we might see people on Friday again, or at the resolutions meeting on Thursday. Who knows?
Yeah, people seem pretty enthusiastic, especially after after this 2 speakers about what's possible. I feel like a lot of people are like, yeah, let's do it. Let's sign me up. And I was like, this is very cute. I'm excited. I hope that energy is sustainable, but I'm at least happy that people have that energy.
Yeah, the speakers did a really good job.
Yeah.
It was awesome. I feel such good energy. Well, I always love Kristen anyway, but she really emotes such positivity. I don't know. I just love her so much. So.
Well, good night, everyone, and we'll see y'all soon.
Yeah. See you guys.
Good night, everybody. Have a good evening. And we'll see you very soon.
Yes, have a good one.
Good night.
Night.
Bye.
Bye.
Tanvi, you did terrific.
Thank you. I was so nervous in the beginning, but I'm glad it went.
It's a friendly,
Yeah,
it's a friendly crowd.
You did terrific. You did great. Just
And you didn't
yes,
look
thank you.
nervous.
No, you did terrific. Thank you so much.
Thank you guys for doing this. I'll
Yes,
see you.
absolutely terrific.
Yeah, we'll see you.